Okay, hi everyone. My name's Lawrence. I'm your friendly OT here, and I'm joined here by my good friend Adam, and he also happens to be an occupational therapist. We went to school together. We did our best to pay attention to the lectures, and we're practicing now for a while. And Adam over here, he has a different field than I do, or specialty. That's why I wanted to bring him onto the show. Adam, why don't you tell everyone here what specialty you're in?
Sure. Hi. I work with hands in the upper extremity. So I'm a hand therapist that specializes in treatment of the upper extremity and see a wide range of injuries or conditions that affect the hand, fingers, wrist, elbow, and shoulder.
Awesome. So, what drew you to hand therapy? I know you wanted to be, or not wanted. You started as a pediatric occupational therapist, and then you sort of kind of rediscovered or discovered hand therapy. Were you always like a hand therapy kind of guy when we started in OT?
Well, I had three different internships altogether after OT school. One of which was in pediatrics, working in a school, and then one of the other ones was in an outpatient hand therapy clinic. And I thought they were both really interesting and really fun. And so the first job that I just kind of took what I could find was in a pediatric clinic working with kids, which was super fun. They just balls of energy and gave me a lot of fun jokes and stuff and kept me up to date with Pokemon Go and Fortnite and dances and all these other fun, crazy things. And that was awesome. But then I had back surgery, so I ended up losing that job because of that. I was out for a few months, recovering from that. And then the next job I was able to get, which I always had an interest in, was hand therapy, another outpatient clinic in Castro Valley. And I was drawn to hand therapy because of my experience in field work. I really enjoyed seeing kind of the recovery process, the different various, therapeutic interventions that the therapists would produce for their clients and how well they worked and the good success rates they saw, and just kind of how fascinating it was to see the recovery of someone that couldn't move their fingers at all. They came in with stitches and dried blood after surgery and in a cast, and then seeing them gain almost full range of motion back by the time I left, which was just 3 months later. So
It's all because of you, right?
what's that?
It's all because of you. They regained their range of motion.
Yeah, super OTs, that's how it goes.
For OT.
But
Awesome.
yeah.
That's great. That's what I love about OT. There's so many different specialties. Like I'm a pediatric OT, and you're like part pediatric OT, but now mostly a hand therapist. So that's the beauty of OT. And then some of our classmates are working at a skilled nursing facility, and some of them are at an acute rehab hospital. We're essentially everywhere, and
Yeah.
that's the beauty of it. But before we continue, we got to give a shout out to our alma mater, the Winds of Healthcare School,
Yes.
Samuel Merritt University.
Samuel Merritt.
Winds of what? The Winds of Healthcare. That was our mascot, right?
Yeah, the changing winds of healthcare.
It's in Oakland too, so like really good, really good school.
Very good
Fun.
school. Yeah. Great
So
teachers, great staff.
shout out to our professors if you're watching this video. We're doing our best to do evidence based practice here and
Mhm.
educating everyone. So we're bringing OT to we're advancing OT and making it available for everyone. That's why other side occupational therapy for all.
That's it.
That's the goal of this YouTube channel is to bring OT for all and make it be very accessible because no one really knows what OT is, even though we have such awesome professions and we get to help a lot of people.
Mhm.
So let's get into our topic today. We're going to talk about different injuries to the upper extremity. And most people, we take for granted our upper body, right? Whenever we drink water, we take for granted our ability to be able to grip the cup and then drink it, or even reach for that cookie late at night, like when we're using our
Oh,
shoulder, we're doing that shoulder flexion and reaching and grabbing it. We take that for granted. Even brushing your teeth, even sleeping in bed, like moving, that's part of an occupation that we do, right? Sleeping, resting, using the bathroom, like wiping your butt, those things. Like there's a lot of activities that are involved here in the upper extremity. So when we hurt our shoulder or we hurt our hand or something happens like a chronic injury, we definitely feel that because we immediately notice the deficits in our function, in our independence. So, and sometimes for older adults, the independence too. And I know for a lot of kids, kids do a lot of sports and they always tend to land on their hands. And, that's one of the most common injuries. Adam's going to explain more later, the Colles fracture, right?
Mhm.
And that happens in it prevents them from being able to write, being able to play video games, being able to do schoolwork. So it's really important for us to understand how we can treat these injuries, when to go see a doctor, what it is, and home remedies you can do at home. Because you could see a therapist once a week, but it's really the follow through that you do at home. I'm sure Adam's going to talk about this more. It's what you do at home, the exercises you do at home that the OT or the physical therapist recommends, so that you could build that strength and regain that range of motion that you lost because of a certain injury or a surgery or chronic pain that you're experiencing. So let's go ahead and dive into the first question for Mr. Adam Lowe. Carpal tunnel. So that's very common, right? You know, you hear that a lot. So what exactly is carpal tunnel, Adam?
Well, carpal tunnel is the most common nerve impingement that you see in the upper extremity. So what's happening is you have a series of nerves that run through your upper extremity all the way down from the back of your neck and into your hand and to go into your fingers. So with carpal tunnel specifically, the nerve that's going to be affected is your median nerve, and that's the nerve that kind of runs right through here up
I
into
think
this
we have a
portion.
picture of that. Let me pull that up in a sec. Yeah, go
Yeah,
ahead and keep talking though. Sorry for cutting you off. There it is.
that's
See
okay.
that?
Yeah, that's a very good diagram of it, good picture. So what happens is you have the median nerve that runs through a literal tunnel, as Lawrence is showing on the screen right there. So the tunnel is comprised of bones on the bottom and the sides, and then the top is going to be a ligament that runs over the top, which is called the transverse carpal ligament or flexor retinaculum, depending on whichever one you want to call it. And they're going to be encompassing and going around 9 different structures altogether, which include tendons, the median nerve itself, and a thing that's affected when you're experiencing carpal tunnel symptoms is the median nerve is going to be experiencing some sort of pressure that typically comes from inflammation that's a result of one of the tendons that are running through the carpal tunnel being inflamed. And they're pushing on the median nerve, which is going to be resulting in typically tingling, sometimes numbness that you're going to experience either in the palm of your hand or in either your thumb, index finger, middle finger, and then sometimes part of the ring finger. It just depends on your nerve distribution.
Right.
Um, yeah, it can result in muscle wasting as well and weakness. You might find yourself dropping objects, but mostly it's that tingling and numbness. You're going to feel like you want to shake your hand
So
out.
that's one of the first signs that you may have carpal tunnel, right? Or your carpal tunnel is being impinged. Or the median nerves are being impinged at the carpal tunnel. Which fingers are affected? What fingers do the median nerve affect? The
So it's going to be your thumb, almost always. Everybody's a little different in their distribution, but thumb, index finger, middle finger, and then sometimes part of the ring finger because that's the innervation.
so you'll feel the numbness in this area.
You might feel
Do
it
you
in your
randomly
palm.
feel the numbness, or do you feel it when you're doing work, like when you're keyboarding? I know a lot of people work in front of a computer. So do you feel it when you're doing the work or when you're resting?
Both actually, especially it's made worse when you're using it for positions or activities that are causing the symptoms to feel worse. So if your ergonomic setup is, for instance, not very good when you're using the computer, I know a lot of people are working from home right now and might not have their ergonomic setup that they would have in their offices. So they're, having to type with maybe an extended wrist or on a desktop or level that's not level or it's too high or too low. That could be a predisposing factor to making your symptoms worse. But yeah, it's probably going to be worsened when you're actually doing the activity, but you may still feel it when you're at rest or even at night when you're sleeping. It might wake you up.
Wow. So you'll definitely feel that numbness, and is it accompanied by pain, the tingling and numbness?
Sometimes. Yeah, some people report pain, but typically it's their, complaining of that numbness and tingling or like ants crawling on their hand or their fingertips. And
Yeah,
um,
you definitely feel that pain, right?
yeah, you'll have pain typically, but it varies, person to person. But yeah, you're gonna have some sort of symptoms, and it's because that median nerve's getting pinched on or impinged in some way.
Great. Okay. No, that's really interesting because I know a lot of people like they try to ignore certain symptoms, right? Like they're like, oh, it's probably just because I was overusing it. When should they see their doctor? Like when they feel that first sign of numbness, or they should wait for a while? Like, I think that's really critical, right? Because the sooner you see a doctor, it helps prevent surgery, right? Because there are some exercises you can do to kind of prevent surgery when the median nerves impinge at the carpal tunnel.
Yeah, I mean, ideally, you want to see your doctor or a hand specialist if possible as soon as you can when you start feeling symptoms. Because the thing with any nerve impingement, including carpal tunnel, is the longer that it goes untreated, the more potential long-lasting damage you're going to be experiencing in the affected nerve. So even if you end up having, let's say, a carpal tunnel release at some point, if you've waited for a number of years to do that while you've been experiencing symptoms the whole time, there's a possibility that you could not see full resolution of those symptoms, which is very frustrating for people. But there are things you can do at home to try and treat it yourself. I know right now with COVID going on, some people may be reluctant to want to go into a doctor's office or expose themselves to things like that. So there's a variety of things you can try and do. The biggest thing that I would recommend is to try and identify what activity is causing your symptoms to be worse and try and modify it. So if it's typing at your computer and you suspect that that's what's causing it to be worse, I would suggest getting, they have free ergonomic evaluations online, things that you can look at, like having the feet flat on the floor, the computer monitor at eye levels. You're not looking down, you're not looking up, so it's nice and level. So you're not cranking your neck.
Right.
Nice neutral wrist when you're typing, things like that.
What does
But
neutral wrist look like for people that don't know what a neutral position is on your wrist?
yeah, so I can try and show you here. So if you're typing like this, you want to be having your fingers nice and able to just do all the work. The wrist isn't moving at all. You see my fingers are kind of moving and flexing
Right,
right
right.
now.
It's like the hand from Adam's Family.
Yeah, it's it thing.
The thing.
Yeah.
But that's
Um,
neutral. Okay. So you don't want over reflection or extension. I know some people put books or they have their like keyboard like down. So you wouldn't recommend, you just recommend it being neutral. Like here's an example of an Apple keyboard. Would you recommend a keyboard like this, like a flat keyboard? Or would you recommend more of like a keyboard that has a gel pad that their wrist could sit on?
Gel pads are nice because they're going to stop from the table surface, if it's a hard surface, which it typically is, from potentially causing any kind of pressure that's unwanted on the wrist and, causing pressure sores or things like that, or just discomfort. But I would recommend, they have some really nice ergonomics, keyboards, which you can find on Amazon. They're kind of like a pyramid shape. So you're sort of holding it on the sides like this, like the keyboards, if you can imagine, like a triangle in the middle or
Right.
more like a circle. But the idea is it's going to enable you to not have to, not want to bring your wrists up into extension or
Right.
down into flexion.
So if you could have like a ball keyboard, that would be the most ideal one. Hey, that could
Yeah.
be our next invention. Like this, we'll call it the sphere, and
Yeah.
then just be able to type like because that's neutral, right? Your elbows in certainly like you're like this. This is the most neutral place. Like you don't
Well,
want to be putting your hands on a crystal ball.
Well, yeah, for the wrist, definitely that's a nice neutral. And for the elbows specifically, if we're talking about ergonomics, you want them to be 90 degrees or greater. So ideally, if you can, you have your laptop, you have like a pad that you can set it on or some sort of surface in your lap. And
Mhm.
then the keyboard is on top of that,
Mhm.
because the elbows being at a degree that's greater than 90 is going to be the most ideal for them in terms
Right.
of causing any kind of impingement
Yeah.
or
So for people that work an office job, I know there's a lot of typing involved. When should they stop? Like, should they keep keyboarding for like hours, or like, is there like every 30 minutes should they take a break and like stretch their wrist? Like, what do you recommend?
Oh man, I absolutely recommend taking breaks because I've seen it firsthand. There are people that, their jobs entail typing constantly, and, they get so into the zone that they lose track of time and they're, like you said, typing away for hours. And then they realize, oh, my hands, my fingers, they're hurting later on in the evening. And it's because they weren't taking breaks at the frequency that would have benefited their body, their joints, their fingers, their tendons, their muscles as much. So I would say every 30 minutes at least you should take about a minute break. You can stretch your fingers out. You can just make a little fist, open them up like that if you want. I can show some tendon glides and things like that to do later potentially. And also resting your eyes, try to get some natural light, some sunshine if you can't look out a window. Just giving your whole body a break and your mind a break too, of course.
Right. Absolutely. And I recommend that for a lot of my students that I work with at school as an OT. Sensory regulation. I know
Yeah.
that there needs to be more studies on that. But it is important for people to take a break. But yeah, and I really, yeah, all these exercises, just moving your body, some tendon glides, right, are really important. So very, very good. Are there any home remedies for people? Like, let's say they have carpal tunnel, or but they don't need a surgery. So, what can they do at home to prevent that surgery from happening, to kind of release that pressure on their carpal tunnel?
Well, ideally, what you want to do first, of course, is before you do anything, is see a doctor. Ideally, a hand specialist. They may recommend an MRI or a nerve conduction study, X-rays, of course, just to kind of see what everything's looking like. The nerve conduction studies are pretty accurate
Right.
as far as identifying if there's what the impigement's like in the nerve. They may
Right.
recommend a cortisone injection, which is basically a really large anti-inflammatory injection that's going to decrease that swelling potentially that's causing that impingement on the median nerve. And see if that helps. For a lot of people, it does help, but it's temporary relief. But in the meantime, they'll probably also recommend nerve glides, doing some forearm stretches like this,
Right.
nice gentle movements. Like I said earlier, trying to identify what
Like
it is.
5 seconds or 10 seconds when you do that, like stretch 5 seconds
Well,
each.
what I recommend is doing 4 sets, 4 repetitions, hold for 15 seconds each, but you really need to be mindful.
Flexion,
And that's flexion. So this is flexion right here,
and then extension.
then extension. So I'm not really doing it. Let me try and kind of get back a little bit so you can see it a little easier. But so this is going to be the nice extension stretch, nice passive. You don't want to be overly aggressive with this stretch. You
Right.
want to just do a nice gentle stretch, holding for 15 seconds with your other hand. If you don't have another hand, or if the other hand's affected too, you could always do this against a wall. But the
Mhm.
important thing with this is to watch for any increase in symptoms. If you feel an increase in tingling or numbness, let up on the stretch a little bit. You
Right.
don't want to be making symptoms worse.
Listen
And
to your body.
exactly. And this is the opposite way. This is flexion. So like I said, 4 times, hold for 15 seconds each. Do that maybe 2 or 3 times a day, and you're just going to see if it helps to improve your symptoms at all.
Right.
And the other thing I would recommend is nerve glides. You can use Google and find a lot of different options as far as getting the median nerve to kind of floss through your body in terms of the movements and do a nerve glide.
What do
The
you mean
two,
when you say when the median nerve to floss? Like for our listeners out there, what does
yeah,
it?
so you're putting it through its full range of motion, essentially. You're getting it to kind of glide through its space in your body that it's normally has allocated, that could be getting kind of pinched or impinged on because of the swelling that might exist in your carpal tunnel or anywhere else up the trail through your body to your neck.
Mhm.
As far as the nerve glides that I recommend, that I typically have given my patients, there's two. So I call this one like a stop and go. So I'll
Okay.
stand up, hopefully you can see it. So what you're gonna do is you start right here, bring the wrist up, your fingers up as much as you're able to. You can kind
Hmm.
of see it like that. Go all the way out into the front, out to the side.
Right. Well, and your wrist is still like maintaining extension, like full range, right?
Yeah,
Without.
and your wrist is extended as much as you can, and that's 1 repetition. So let me do it again because it kind of moves. So you go out like this, nice, gentle, slow, controlled movement, and then you just bring it back,
Okay.
right in. And you can do 10 of those. I wouldn't do it any more than that. And again, 2 or 3 times a day.
Mhm.
And then the other one is this one. I don't have a fun name for this one, but you're gonna bring the wrist up again like this,
Mhm.
front, turn it over, thumbs out here, other hand comes under. Just a nice gentle stretch. You're opening up that carpal tunnel in there. So I
Right.
hope Hope you can
Yeah,
see.
no, that's a pretty good view. Yeah, you did a pretty beautiful movement there, Adam. Like when you did that
Thank
stretch,
you.
you
I
did like
try.
that. You could be a hand model if you wanted to.
Oh man, man, thank you. That's my dream, man.
Oh, you're in in a hands, dude, hand therapist.
I'll be a burger, yeah, for Burger King. You know, I got hands to make the burgers look big, right? No,
Exactly, exactly, and that's why I want to make sure to take care of your hands because hands are important. It makes
yes.
things better.
People don't realize how much we use our hands for every day. You know.
Yeah. What other? So you mentioned those couple stretches. You mentioned that nerve glides. What else do you recommend to
I,
open carpal tunnel?
icing for sure. You want to be very mindful.
Or icing when there's numbness, or just icing at intervals during the day.
So what I would recommend is you do some of the exercises that I just showed, the hand and the wrist stretch, the nerve glides, and
Uh-huh.
then finish with ice at the end of your exercise routine, if that's what you want to think of it as.
Right.
If you're doing the ice, always make sure you're using a towel or some sort of buffer between the ice itself, which should be, if it's actual ice cubes, like in a Ziploc bag or something,
Mhm.
but to protect your skin with that towel and do it no more than about 5 minutes. You can wrap up your whole wrist, your whole hand, depending how big your ice pack is, of course, what you're working with. But don't put it directly on your skin and don't do it for more than 5 minutes because the skin and the musculature in this area in your hand and your wrist is very thin, very small. It's very easy to get a frostbite burn and just have some really uncomfortable blisters, things like that. So protect your skin. 5 minutes, nice towel to protect it or a different interface. Try to get some of that swelling down, ideally. If it's been going on for a really long time, it's what's called a chronic injury or chronic condition. You can use heat as well. But if it's what's called acute, or if it's only been going on for a short time, you really want to only use ice because the heat could actually make it worse. So that's
Okay.
my recommendation.
There's different studies about different treatments that people try out. Like I know they have like the compression, the heat, ice and heat compression. Would you recommend that? Like 3 minutes ice and 2 minutes of like heat, kind of like acting as a pump. And
So
then
like that contrast bath type of thing. You could
yes,
try that. You could try that. Again, though, if it's an acute injury, I would definitely recommend to go with ice only,
right.
to try not to make any of that inflammation worse. But honestly, whatever helps alleviate your symptoms, whatever feels, like it's helping. If you find something that works for you, like, go for it. Absolutely.
Right. Yeah. Great. Well, any other? How about after surgery? So we talked about like carpal tunnel, trying to prevent surgery, but in the unfortunate case that you do need surgery, and well, maybe you can talk more about when people need surgery for that. What can they do? I'm sure they're going to see a hand like see a doctor and also see a hand specialist, but what can they do at home after surgery?
Yeah, yeah. So yeah, the good news is carpal tunnel releases are very straightforward, very simple surgeries. They take about 15 minutes for the surgeon, a good hand surgeon, to do,
Mhm.
and you're going to be in the hospital for probably about an hour, hour and a half in total. So you'll be in recovering from the anesthetic afterwards. But once you get home, they're going to have you kind of wrapped up in a big bandage and tell you to keep it dry, don't get it wet, don't shower with it, that sort of thing. And it's going to be about 4 weeks or so before you're going to come back and get your sutures out, and they're going to send you to hand therapy most likely. Now, if you're seeing a good hand therapist, they're going to guide you through everything that you're going to do as far as your progression goes, but they'll guide you along the way to that. Once you're at your it would actually be your 4 week mark after surgery. That's when you can start to think about doing some strengthening activities following a carpal tunnel release, but your doctor may have a different standard, or your therapist. So follow, whatever they recommend. And you're going to be doing some nice passive range of motion activities, similar to the stretch that I showed before. So you're doing like the wrist, it's called a wrist extrinsic stretch for extension and flexion. You're going to probably be doing some active movement exercises too. So you're going to be like doing a handshake type of motion, that's ulnar and radial deviation.
Mhm.
You're going to be doing some supination, pronation, and you're just trying to get the movement back so that you can have your full range of motion again. Then once you get to strengthening activities, they'll probably give you some therapy to take home to kind of start squeezing and all that sort of thing. But my recommendation, just speaking generally, and don't want to get like too like specific with it, right? Is once you have the sutures out, once you are, once it's all cleaned up, like there's no open scabs or anything like that, you can definitely start getting it wet, start washing it, kind of treating it more normally. Don't do any heavy activities initially. Like don't start, if you like to go to the gym, like don't be like, oh yeah, I'm gonna do 300 pound chest test right now, like after I just got my sutures out. No, you're going to be in a lot of pain, potentially bringing that tingling and numbness back, causing inflammation. So go slow. Do like little light activities at first, and kind of ramp up to doing the heavier, more challenging things. But
Right.
you
No,
know,
that was very informative, Adam. Really, thank you so much for that. Carpal tunnel. I know that's one of the more common ones. Let's move on to our next one. I could never get the pronunciation right, but Adam's going to correct me. The Quervain's tenosynovitis.
yeah,
So it's pretty common, and people notice it a lot when they're writing. As a pediatric OT, a lot of my kids, like I'm working on a lot of writing.
yeah.
So I'm not, like what is that? What is the Quervains? And then correct my pronunciation. What is that? What's going on there?
No, I like the way you pronounce it, but it's great. I've always heard it pronounced Decrevins, tenosynovitis, but I mean tomato, tomato, right? But basically, what it is in your wrist. I'll try and show you on mine. It's going to be on the back side of your forearm and then up into your thumb area. You have what's called some tendons that will extend your fingers like this, right?
Mhm.
There's two of them in one specific compartment over here on your thumb side that's affected during the diagnosis of Decrevein's tenosynovitis, and it's the one of the tendons that extends your thumb, extensor pollicis brevis or EPB, and then the one that moves your thumb out. So if you're doing that kind of a motion, which is abductor pollicis longus. So what's happening is there's a sheath that goes around those two, and it kind of keeps them safe, keeps them, with all the nutrients that they need and flowing well and moving good. What happens is there's inflammation.
I'm there for you to help us.
Perfect. Yes, that's great. Much better than me trying to fiddle around with all my stuff over here. But yeah, you'll see in that image there, you're going to see the inflamed tendon right there. And then there's the sheath that it's kind of getting pushed down because you see this swollen tendon sheath underneath. So it's
Right.
causing you pain, typically during pinching activities that you're doing with the thumb. If you're holding a weight or books or something with your hand, and you're pinching down with the thumb and it gets kind of pulled down into flexion, or an extension if you have your forearm up, like the supinated point of view, and you're going to be having pain that's going through your thumb right in the area of your wrist where it's kind of red and highlighted in this image here.
Right there. Yep.
Yeah. Mm-hmm.
Great. Okay. So that's what's going on. You don't necessarily need surgery for this one, right? A lot of times the doctor might recommend a splint.
Yeah. Of course, the goal is to avoid surgery for any of these guys, but yeah, they recommend wrist splints a lot of times, as long as they have a thumb spica or just like a little kind of tube that goes around half of the thumb to kind of keep it in place. And that's just to kind of help remind you to take care of that and to not lift really heavy things if you can help it with that side, or if you do like an underneath kind of lift.
So kind of like this. This is what you're talking about, the thumb spica,
Yeah.
right?
Yeah, any of those would be fine. They may provide one for you, your provider, or you could pick one up at CVS or Walgreens or any like Rite Aid, things like that.
Should they wear it during the night as well? This one's a night thumb, so I'm just curious.
Yeah, you can definitely wear them at night. Wear them at night or when you're doing activities that might aggravate it.
Mhm.
Just so you're kind of reminded to take care of that wrist and that thumb area, and again, avoid lifting heavy objects and doing manipulation activities, especially if it's going to involve like sustained flexion or extension, or involve pinching with the thumb. So just trying to take care of it. That's the idea with them.
Right. Yeah, because whenever healthcare providers recommend a splint, we're asking the patient to prevent a certain movement. Is that correct? So
Yeah, pretty much.
yeah, it's like don't do this. If it hurts, don't do it. One of the things, right? Like, hey, it hurts when I do this, then don't do it. That's the best advice we can give you.
It's sometimes the hardest advice to follow, though.
That's a good point. Yeah, it's super simple. Like if it hurts, then don't do it. Wait, rest, and then like check again. When should I see a doctor? Like is it noticeable pain when initially?
Well, everybody's different, but in the patients that I've had, in my experience, yes, you are noticing it right away. Typically, you might even see some inflammation in your wrist or in your thumb area. It could be painful to the touch. There's a couple of different techniques that you can do. It's one of them is called a Finkelstein test, where you
Can you
tuck
share
your thumb
the
in.
Finkelstein test? There you go.
You tuck your thumb in like this, and then you bend it forward. And if you have pain, which is kind of an uncomfortable motion anyway, you got pain right there. That's a positive for Quervain's. So
Sweet. And then for young kids, to check that, you could just show, hey, can you do the invisible thumb or the the right? Look, my
yeah,
thumb is doing, yeah. And if it hurts, if they can't do that, hey, positive. You need a
yep.
splint. Hey, is it common for kids? I work with kids. I'm just interested, like in a pediatric setting, like at school. Have you ever seen a younger, uh, patient that has?
Not for Quervain's. It's not as common. They've got young, supple little tendons, and everything's moving really well. And kids bounce back and recover from things so fast. It's amazing. But
Got it.
uh, and usually they're not doing the activities that adults are doing that are causing this, like repetitive pinching for what your job might be, or texting. Although kids are texting younger and younger, so.
How about writing? Like if they don't have the proper grip, could that cause deck remains?
Possibly. I'm not going to say it's impossible, but
You'll have to try.
yeah, it would typically it's injured because you're picking something up and you're doing a pinching motion, like you're picking up a heavy object. Like if I pretended this pen was like really heavy and I'm struggling to get it up and it's going like this and it's bringing me down, and I'm doing that for a sustained amount of time. That's a lot of pressure on these guys right in here, and you could inflame that tendon sheath and cause some Quervain
A
symptoms.
lot of chefs maybe could have that from like holding.
Oh yeah, definitely chefs. I mean, the chopping motion, or anyone who's constantly doing like twisting, rotating motions with their wrist.
Yeah.
Yeah, like people that are mechanics.
A lot of electricians, maybe
Oh yeah,
construction workers.
yeah, plumbing, working on cars. All
Right.
sorts of different stuff could cause that for sure.
Yeah. So what other exercises can they use at home, and what other like what remedies can they use at home? Like if it's really really painful, what can they do to help prevent the swelling, or what can they do to help reduce the swelling? Because I know you can use modalities, but one of the best things that we recommend when there's swelling is range of motion, right? Because that's the best way to get the swelling out if you get range of motion in that area. So what do you recommend?
So start slow and start with some really nice, gentle, active range of motion activities. If you see a hand therapist, they'll be able to give you a good breakdown, but I can tell you some right now. If you can see my thumb on here, I don't know if you can or not,
I can
but
see, we can see
some,
it.
okay, good. So you can just do some really nice, gentle, active extension, which is this motion here, and then flexion, which is that motion here. You could
Right.
do it like in your palm to across, bring it all the way over like that. And you just want to do maybe 3 sets of 10, but monitor how you're feeling. Like if it's painful doing this, do 1 set of 5, 2 sets of 5, or 3 sets of 5. Whatever you're able to do, you're just getting it moving, getting the blood flowing. Then you can also do some active wrist motions, like what I showed you earlier. You're not going to hike up your shoulder like this, but I'm just raising it for the camera. You're doing some flexion, extension, ulnar deviation, radial. You're going to feel it most likely the most in this motion here, which is ulnar deviation. It's like
Mhm.
you're doing a handshake, but up and down, but usually down towards the pinky side, you'll feel that. So you can do those guys just nice and gentle at first, see how it goes. Maybe some passive, like what I showed you earlier when you're standing and you're getting that nice kind of extension, but very, very gentle. And
Right.
you can do flexion 2, 4 times, 15 seconds for all these guys, maybe 2 or 3 times a day. But again, starting slow and just seeing what you can do. I find that ice works very well for this specific condition, and just kind of cooling it down and then trying to just not use it as much. Rest and disuse and avoiding the activities like you said that hurt or make things worse is absolutely the most important thing. Just trying
Right.
not to flare it
And
up.
ice just reduces the swelling, right? This main thing. It reduces the swelling, and it also decreases the pain. it also acts as anesthetic.
I mean, ideally, you won't need surgery for all of these. This is the goal. So
Yeah.
if you try and just treat it well, they call this mommy wrist also because it's very common to see people that have small children or infants develop this condition because when you're lifting up a kid or a child, you're going to a lot of times lift up under the armpit or you're going to scoop underneath and kind of have your wrists in that flexed or sorry, extended position like that for a sustained period of time, or holding a bottle, you're holding it like this and you're feeding the baby,
Right.
flex the wrist for a long time. And that's going to aggravate those tendons right through there, just like we've been talking about. So, and then also, if you're a pregnant woman or if you just gave birth, there's a lot of different hormones that have changed and inflammation throughout the body because of just the tendency for pregnancy to cause that to happen. And so you might be at a greater likelihood of developing Quervain just because of that, in addition
You'd
to the.
recommend for mothers or like caretakers of young children to wear a splint if they do have that, or even could they do that before when just to prevent that from even happening? Could you just wear a splint if they're taking care of a kid during the day? Could they just wear a splint to kind of just prevent that movement from happening when they
You can, yeah. I would just watch for,
prevent? An ounce of prevention is better than a pound of cure. So just trying to think how do I not get injured in the first place?
yeah, I mean, you can definitely do that if you feel like the splint isn't affecting you negatively in any other ways, because sometimes they can cause other things to happen. But, if you're feeling any kind of wrist pain or you suspect it might be Quervain's or it's in the thumb, yeah, you could try a wrist splint out, see if that helps.
Yeah, well, that's great. That's great that you're able to do that. I'm just like I'm more of a prevention kind of guy, but just trying to see what else they can do to prevent that.
Yeah.
What other recommendations do you have for this condition?
For Quervain's, aside from seeing a hand specialist and maybe getting a corticosteroid or a cortisone injection, trying to avoid surgery, disuse, ice, stretching, rest, and I mean, heat might feel good, but again, if it's an acute injury or if it just happened, I would avoid heat. If it's a chronic one, it's been bothering you forever, it's chronic, yeah, you can try some heat. But other than that, just rest, ice, do your active range of motion, your stretches, and hope that it gets better.
Yeah, well, thank you for all those suggestions, Adam. Okay, well, let's move on to our next one. I'm going through this. I have like some rotator cuff injury, and I know that's very common. I think we identified it to be like one of the teres muscles, the major or the minor.
Mm-hmm.
But let's talk about shoulder injuries. What are the most common ones that you've seen?
Sorry if you can hear my dog snoring. He's in the room, but
No, not at
he's
all.
yeah, rotator cuffs or rotator cuff strains or tears. A lot of impingement, which basically just means like general pain in the shoulder. Those are definitely the most common that I've seen.
Yeah, so let's go ahead and start with impingement because I know like what is an impingement like, and when do you notice that?
Yeah, so impingement is going to be what's happening when okay, so you have four different rotator cuff muscles. A lot of times people think that you only have one, but that's like a misnomer. There's four of them. So you've got one in the front, that's subscapularis, and then you got the other three that are on the back. So you've got supraspinatus, which is the most superior or the highest one up on your shoulder. Underneath of that, you've got infraspinatus, and then underneath of that, you've got teres minor. Lawrence might be pulling up a nice visual for
Yeah,
everybody to look
rotator
at.
cuff. I'll pull it up. Yeah, I'm like looking
Yeah.
it up. I'll be
So
keep going, Adam. You're doing great.
thanks. So what's happening during impingement is that supraspinatus, typically because of its positioning in the shoulder itself, is getting pinched between the head of the humerus and the typically it's going to be the acromion or the top of the glenohumeral joint because that's what creates that. And so you're kind of doing a lot of lifting or internal rotation activities like chest press, things like that. You're going to be kind of pinching that supraspinatus muscle in between the head of the humerus and that acromion bone. And you're going to be kind of wearing it down more and more as it continues to, happen or whatever movement you're doing. And you're going to have pain because of that. You might see some.
Here's a better diagram here.
Yep, there it is. So yeah, supraspinatus right there, and you can see it attaches onto the humerus. The head of the humerus is kind of that ball. See where the word humerus is, just go look straight up, and that's the head of the humerus. Supraspinatus is identified right there, and then the tendon of supraspinatus. And then right above that, that bone that kind of flares out to the left a little bit, or it's my left looking at it, you're going to see that's the acromion, right? So when you're doing any kind of an elevation activity, you bringing that head of the humerus up, it's going to go to its limit, which is that acromion bone. And what's in between that is supraspinatus and its tendon. So you're going to be getting a pinching on that. And that's what impingement is. And you're just making that tendon
But
more
it
and
is
more.
right here, impingement syndrome. Is that what's going on?
That's it. That's exactly it right
Yeah.
there.
Yeah. And what motions are most affected when you have an impingement syndrome?
If you're doing any kind of like an elevation activity, like raising the shoulders up, if you're doing like any kind of internal rotation, like chest press,
Mostly right here, right at the where the bursa is.
yeah, or if you're trying to throw, like if you're playing a sport or something like that, any motion where you're kind of raising that shoulder up a little bit, or you're trying to move it in space, yeah, you're gonna be feeling it, and it's not gonna feel good, unfortunately. So.
Yeah, definitely. So, what can you do to kind of help that when you do have that impingement besides surgery?
Right. I mean, nobody wants surgery, especially if you're on a rotator cuff muscle, because that can take a while to recover from. But
Yes.
what you want to do is try and identify the activity that's causing you pain, avoid that. Do some stretches. I got a really nice one that I can demonstrate for you. Let me just grab my tool.
Oh, you're now we're using tools. Now we're getting fancy here.
Well, ideally, you're going to have something that's a little thicker than this. This is just so happened to be something that's here in the room with me. But you could use like a golf club, or you could use
What is
like a
that? Is
broom.
that a bamboo stick?
It's
No.
like a towel. The cat's toys get stuck underneath the cabinet. But what you want to do, you're going to get a nice stretch right now doing this on your internal rotator muscles, right? And so the muscles responsible for internal rotation is going to be your subscapularis, which is the
You
anterior.
definitely use a back scratcher for this one too.
Yeah, I mean, ideally you just don't want to break it, but if you see, I'm holding it like this, like in between my index finger, my thumb, middle finger, kind of right between this. So you put it behind your shoulder like this, bring your shoulder to a 90-degree angle. So you can see kind of it's behind me like that. And then use your other hand underneath to pull it like this. This is why I'm saying you want something a little thicker, but because you don't want to break it. But it's giving you that nice kind of opening stretch right there. And you just want to relax, not do it too hard, but it's enabling you to get a nice external rotation for your shoulder, which is something that people don't do enough of. A lot of the activities you'll do if you're doing like a workout, or if you're just doing your day-to-day stuff, involves pushing or involves push-ups, things like that. So internal rotation happens a lot. External doesn't happen enough. So you want to hold that for like 15 seconds or so. You can do longer if you want, maybe 30 seconds at most. And it's going to really open up that shoulder for you, and just kind of ease up on any pressure that's in there. Doing some other activities that you always want to start if you're having pain, with the easier versions or the less intense versions of exercises. So I want to show you one, but it's kind of like awkward to show. So let me try. Let's see. Okay, so this one is just going to be working your shoulder stabilization or scapular stabilization exercises, or the muscles that are in here. So you can do, I've heard a lot of different varieties as far as this goes, but this is going to be T, X, and Y's. So what you want to do is you go up to a wall. This is not a wall behind me. It's just like movie theater curtains. But what you want to do is you're going to be making the letters that I just said. So we'll start with T. So you're going to go up against the wall, bring your arms out to the side like this, and your hands are facing just like this. Sorry, with the hands down. And you're just pushing lightly against the wall. And you want to start nice and gentle. You're going to try for 3 second holds. And you're going to try to repeat it 5 times. So after 3 seconds, you can bring it back down. And that's just working a nice isometric contraction for the shoulder muscles. Try to hold it in place. You're opening up that chest, getting everything nice and wide to kind of get some external rotation going. So that's one. The next one is going to be called X. So for X, you're going to have the pinky side against the wall again. And you can see I'm making kind of like an X like this, pushing it down. And again, holding for 3 seconds,
Mm-hmm.
stopping, and repeating 5 times or so, whatever you're able to do. And then the last one you're going to do is Y. So Y is going to be like this, but this time the thumb is going against the wall. You're just holding like this, 3 seconds or so. Bring it down. You can repeat it 5 times. And then another one's a nice, easy one is like a nice chest opener. So if you have a corner in your house or if you're going in a doorway, I'm miming a doorway right now. So you just stretch, lean into it. That's going to open up your shoulders and your chest. Get a nice, good stretch there. You want to do that one 4 times, repeat it, hold for 15 seconds, repeating 4 times. And for all those stretches I just showed you, you can do 2 or 3 times a day, like in terms of your sets. So like for the X, Ys, and Ts, if you're doing those, you're holding for 3 seconds, you're going to be repeating them maybe 3 times, maybe 5 times, depending what you're able to do, 2 or 3 times a day. I hope that makes sense.
Right. No, that's really good. And you mentioned a lot of sets, a lot of reps. I think the important part here is we can give you this information. We can give you the stretches. We can give you the range of motion exercises. But it's up to you, or your patient, or like, to do this at home because they see us once a week. If that, and I think it's up to you to do it at home. And you're like, oh, I'm not improving. It still hurts. Well, I still don't have the range of motion. It's like, oh, you got to do it. Well, if it hurts, don't do it. Like what Adam said.
Yeah.
But if you're trying to increase strength, if you're trying to stretch that area, you just got to do it. You just got to follow through with the game plan that we're giving you, or the stretches that we're doing. Yeah, don't you agree, Adam? It makes the process a lot faster, right? If we're
Yeah, if you buy it, we need people to buy into what they're doing. As a therapist, you absolutely need your clients or patients to buy into it and adhere to it at home. That's honestly that's the biggest thing. You're going to see faster improvement if you do the things that you're supposed to do at home. That's the biggest part.
right, great. Yeah, no, the shoulder's really important. You don't really notice it until you try to get that cookie jar like up in the top shelf, and you're like, I have
Yeah.
to do it. I need to do my stretches. Great. What other common shoulder injuries have you noticed? Let's talk about one more, then we'll move on to the other. Like we'll move on to another one.
Yeah, so there's a whole bunch of different things that happen with shoulders. Those are the most common ones that I've seen because we in the clinics that I've worked at, we've always had physical therapists too that take the majority of these shoulder injuries that we see and they share them with us, but they take the majority by far. So I've mostly worked with like rotator cuffs and impingement. I do.
Got it. Cool. Yeah. Well, we just get the leftovers from the physical therapists.
Sometimes I guess.
Yeah. So PTs out there, give a like on this video. Okay, let's move on to the next one. Tennis elbow.
Mhm.
Tennis elbow. Let's talk about the tennis elbow. Tennis is one of my favorite sports. So, is it necessarily from tennis or the motion from tennis? Why is it called the tennis elbow in the first place?
So it's called tennis elbow, and I don't play tennis, so maybe you can help with this a little bit. But it's one of the motions. I think is it when you're serving, when you're
When you
pushing over?
serve, go up, and
Mhm.
you do
Yeah,
that motion. Is that from that
yeah,
motion? Yeah.
yeah. It's that motion when you're trying to do like an overhead like whack. You're trying to hit the ball, as hard as you can. It's a lot of pressure going down on these tendons that are in your forearm, running on this side. And then when the wrist makes contact with the ball or just the racket itself is going down like that, you're going to be feeling some extra pressure potentially on, yep, that area right there where the redness is. That's your common extensor tendon. And that's going to be getting a lot of pressure and potentially small tears or micro tears that are going to be causing you a lot of pain.
Mm-hmm.
So it's an inflammation.
Contact, right? With the ball, like when you're serving or when you're doing a backhand or a forehand.
Yeah, or just the motion of moving the racket through space with a lot of force behind it too. It's going to be just a lot of pressure on that tendon, so it's not going to feel very good.
Mm-hmm. So what can you do to kind of mitigate the pains that like let's say I'm a tennis player. Well, I am a tennis player, but I haven't played in a while, and I experienced this. Uh, what should I do? Should I go see my doctor first? I mean, you always recommend seeing a doctor, right? Or could
Mhm.
you do some exercises at home?
Definitely see your doctor if you can, see what they recommend. But stuff for at home you can do, and I forgot to mention this specific one but it applies to everything we've talked about today. Massage, but massage is especially effective for this one in particular because the area that is affected by tennis elbow doesn't get a great amount of blood flow just by nature of our anatomy. Just how it is. So when you are massaging an area, any area, you're increasing the blood circulation, the blood flow to that area just by the friction and the movement of the muscle that's happening. So I would recommend just using maybe a little lotion to kind of reduce some of that, skin potentially burning just from the friction from that. But going for those underlying muscles, doing a nice cross friction massage, which means you're going perpendicular to if you see the way that those muscles in that picture flow,
Goes
they
that
go.
way.
Yep, exactly. So you just want to go across, so perpendicular to that, up and down with your other hand. And
Is it one motion, or could you go both ways?
you can go both ways. Ideally, though, you're going to be going like, I don't know if you can see me like this, but you're going to be, there it is. So you're going to be massaging this way. So I'm trying to roll my sleeve up a bit more. But, so, okay, if you see, I'm going to look at my finger and maybe it'll show up on there.
We can see it.
Okay, good. That's your common extensor tendon, the one that's moving right now. So
Yeah.
what you want to do is go right over it, do a nice, some enough pressure to kind of feel it, but not so much that it's causing extra pain. And you can just go over it just like that. And you're massaging that muscle in there. You're just trying to give it some extra blood flow to promote healing because blood flow promotes healing. So massage would be one. Icing, like we've talked about before, same thing. Do it only for 5 minutes and use a towel to protect your skin. Disuse, trying not to lift heavy stuff or whatever it is that's flaring that up. Don't do it. It can be hard. You can also use what's called a counterforce brace, which they sell at any Rite Aid, CVS, pharmacy type of thing.
Would you wear that not during when you're playing, right? Or could you wear that as well when you're playing?
I wouldn't play, honestly, when you're experiencing tennis elbow or lateral epicondylitis. If you're like an avid tennis player, I would definitely, if you can, try and take a break so it can heal. This is notoriously slow to heal, though. So if you really wanted to or needed to, yeah, you could play with a brace on, sure.
That's
But
what it looks like. It's just what you could get at Amazon for $20.
yep, yep, that's it. And there'll be instructions on there with like how to wear it and how it fits and things like that. But yeah, just to kind of remind you of your injury, which I mean, the pain probably will too, unfortunately, but just trying to like reduce the force and the wear and tear that's going on that so it has a chance to heal. So yeah.
Great. Okay. Yeah, massage and range of motion is important. I really enjoy that. Hey, for shoulder injuries, let's go back for a little bit.
Mhm.
Could you use a tennis ball or a lacrosse ball to kind of move and give that manual muscle mobilization, which is essentially massage in
Yeah.
the area?
Yeah, totally. I mean, we've made some little massagers for patients. You get like a sock or a tubey sock or whatever you got, put a couple of tennis balls in there or just one. And they just kind of throw it behind you, lean into a wall with it, and get a nice little back massage going right under your shoulder blade. And it's going to help potentially alleviate some of
I really
that
love
pain.
that. Like I think when I did that, I just used the tennis ball and it keeps dropping, but the sock, I'm sure it
Mhm.
definitely helps like be able to kind of control that area more.
Yeah, absolutely. Yeah, that kind of just gives you that ability to manipulate it easier.
Pretty cool hack there. Okay, let's move on to the next sport, golfer's elbow.
Okay. Yeah.
Back to one elbow. It's good.
Yeah, so golfer's elbow or medial epicondylitis is, I mean, you could sort of think of it as the opposite of tennis elbow, where tennis elbow is affecting your outer elbow, golfer's elbow will affect your inner elbow. So it's named it's named golfer's elbow because when you're swinging and you're going down and under, you're going to be exerting a lot of force on that area of your elbow, and you're kind of trying to strike the ball. Or just moving the club in that motion. And it's a lot of pressure on the tendons there, which is the common flexor tendon. That's just pointed out in this picture that Lawrence pulled up. And it's just going to be kind of aggravating and inflaming those tendons, possibly micro tears, like I said, for the lateral epicondyle. It's going to result in pain and inflammation, possibly some swelling and redness on the outer skin, and a lot of pain when you're trying to lift objects. So Just like with lateral epicondylitis or tennis elbow for golfer's elbow, highly recommend avoiding heavy, manipulation, lifting heavy objects, playing golf. If you can help it, try to avoid that. You can use the same counterforce brace, ice, massage, and see a hand specialist or a doctor if you can. If you suspect you have golfer's elbow or any injury like that, and they can maybe do a corticosteroid injection or something to help you hopefully feel better. But just like with the other side, the lateral epicondyle, the medial epicondyle, that same kind of massage, you want to go right in there. But the trick with this one is you don't want to press too hard because you do have, your funny bone right in this area. So
Mm-hmm.
you want to stay away from that, the little bumps that you feel, those are your bones, your funny bone or your,
Prominence, you want to stay away from that.
yeah, exactly. If you can, and just to kind of try and get some of that blood flow increased in that area to promote some healing. So those
Right.
are some easy.
Like, I think that was really important to know, like increase blood flow to promote healing.
Yeah.
This is
And
really
you can, yeah, and you can also do those same wrist stretches I showed you earlier, just nice and gentle. Kind of doing some flexion, extension, whatever's not causing pain, because it's good. You want to keep your tendons and your range of motion viable and intact. So if you're able to do that and it's not causing any increased pain, you can do that as well.
Mhm. Great. Well, thanks so much for the golfer's elbow. Let's move on to our final one and this injury. So we're just going to discuss chronic injuries here. We're not going to discuss fractures. Maybe you can have another one. We could talk about that in our another video.
Yeah.
But we're going to go ahead and talk about the last one, the Grateful Dead injury, which is the trigger finger.
Oh, gotcha.
Grateful
Okay.
Dead. Just kidding. I'm not sure if anyone's a fan of Grateful Dead. I hope you're not offended. But what's going on here? What's happening with their finger? They can't rock too much.
Yeah, you're not going to rock very much of this one at all. So for trigger finger, what's happening? It's named for this. You're making what looks like, if you can see in this picture here, that ring finger looks like it's pulling a trigger.
Mhm.
It actually gets stuck in that position. That's called a flexed position. When you make a fist, you might go to extend the fingers back, and one is stuck, and you're like, oh, what's going on? And it's painful when you try to extend it.
You can't
And
get married if you have this, right? If it's on your left hand, like it's really hard for you to put
yes,
on.
you're forever bachelor or bachelorette if you have this on your ring finger. I'm sorry. Yeah, so what's going to happen is it's going to get stuck, but you can force it to get unstuck and extend. What you're going to find is it's going to create kind of like a snapping motion when you do it. And it's probably going to be pretty painful. And the reason that that's happening is if you see in this image, there's a little nodule thing there.
Right.
That develops over time, typically with repetitive flexing of the fingers over and over again, like if you're squeezing a ball, that motion, or if you're gripping the steering wheel constantly, or there's a whole lot of things that could cause it. There's also genetic factors too. But basically, it's inflammation on the tendon itself. And so it gets stuck when it tries to flow through what's called a pulley, because the fingers are all a system of pulleys, right? That are anchored down by different little sheaths that go throughout our fingers. And so when it bumps into one of those sheaths, because of that nodule, it doesn't flow the way that it should. So it's going to be stuck, unfortunately, and you've got triggering. I'm trying to show you just like that. Like if it was to be like that, you're like, oh, I can't get it, and then boom, painful.
Get stuck. Okay, so it's not just your ring finger; it could happen to a lot of fingers as well.
Oh yeah, it can happen your thumb, it can happen all the fingers for sure.
Got it. So what can you do to when that happens? What can you do to prevent that snapping from happening?
Well, your best bet is to try and avoid making like a full fisted grip if you can help it with the affected finger.
Right.
Your hand therapist will make you, if you see a hand therapist, they'll make you a little splint. They're really easy to make, and they just go right over here to kind of act as a reminder, and they prevent you from getting that full flexion. So if it's any of these guys, your index, middle, ring, or pinky finger, I'm doing this motion here, that's going to cause it to get stuck in a trigger. But if you're just going like this, and you're kind of keeping it to a minimum up there, you shouldn't have any triggering doing that. The thumb's a different story. The thumb, I'm trying to show you. The thumb, if it's going to trigger it, you're just moving it like that, that will cause it to trigger. So for the thumb, you actually want to just try and keep it like very straight if you're having to move it at all. And again, if you're seeing a hand therapist, they'll be able to make you a nice little splint to help
Around
keep.
that, and for sure, like when you're sleeping, you they probably prefer and recommend for you to wear that splint to prevent any
Oh
uh,
yeah, for sure.
traumatic.
At night, because this natural reaction when you're sleeping is you might curl up like that, or you
Yeah.
grab the sheets at night, or or something.
Fix that. Is that something that could be fixed? The trigger finger, like
Oh yeah,
free.
definitely.
Yeah.
Yeah,
They
that's
don't
one.
if they don't want surgery, then they could just wear a splint for the rest of their life, right?
You could. I've seen, people say, I'm not going to have surgery. I'm just gonna do splinting. I'll try some corticosteroid or cortisone injections, and I'm just gonna deal with it. It's like, okay, yeah, definitely. And we show them some passive stretches they can do for it. But most of the times, those people come back a few months later and they've decided they're going to have the surgery because it just gets too frustrating for them. Because
Right.
it can trigger, like, some people would have it so badly that they couldn't like unstick it by themselves. They'd have to go see the doctor to do it, which is really bad because then you lose range of motion for your fingers. But it's just a matter of what you want to do.
Even if you do those passive range of motion stretches, it would still cause that trigger finger once that nodule is inflamed, right?
Well, the idea is if you're doing like passive range of motion, which means you're pushing the fingers like, with the other hand or against something, that shouldn't cause it to trigger. It's actually active. Like if you're making an active fist like that or moving, you know what I'm saying? That should cause it. But if you're just doing like this and then you place it back into place afterwards, that shouldn't cause it to trigger.
So what's the benefit of doing passive stretches for this one?
Keeping the range of motion viable. Because you're not doing that range of motion like actively. So doing it passively is what you want to do to ensure that you're not going to get contractures or you're losing range of motion.
Got it. Okay. So this is one of those things where you think that you're not going to get surgery, but you'll eventually get surgery for a lot of people.
A lot of people, most of the patients I can think of, yeah, unfortunately they end up doing it. But the good news is this very simple surgery. It's just like carpal tunnel in its duration. You're in the hospital probably for an hour and a half, maybe. It's very straightforward. Your surgeon's probably done a whole lot of them. You're gonna have most likely gonna have a very good result. So, it's not a any surgery is scary. Obviously I've had surgery and it's very scary, but it's a very common one. And, your doctor is going to take good care of you if you choose to go that route.
Awesome. Well, Adam, thanks so much for all that information. That was really helpful. And hopefully people, I'm sure they're going to use this video and use this as a resource to help them with whatever conditions they're going that they have. So thanks so much, Adam, for being here. Adam doesn't have a YouTube channel. Well, maybe one day he will. But if this video was helpful for you, go ahead and like this video and also subscribe to this channel. Maybe me and Adam will have another video about fractures or some stretches you can do. Adam's he's a pretty good dancer too. So we might put out exactly what not to do in order. Yeah, we'll do like exactly. Don't do those movements if you do not want to get hurt. Just kidding. Yeah, no. Thanks so much, Adam, for being here.
Yeah, of course. I was happy to do it. It's been really fun.